Well, kia ora, and welcome to my chorus. This is a podcast and video that I do with my email newsletter, The Kaka, which is all about Aotearoa's political economy around housing, climate and poverty. I wanted to focus today on an excellent report that's come out last night from Jessica Roden for One News in Nelson. She's gotten hold of some detail about our healthcare system, which is, of course, in a process of cascading collapse. 2 decades of underfunding and rampant population growth are putting enormous pressure on the healthcare system, and it's collapsing in a bunch of ways. As with any collapse, often it's the institutions and the services at the fringes which are the first to go, and we've certainly seen that with Gisborne, Nelson, Palmerston North, Dunedin, where hospitals have struggled to get staff and have not replaced or renewed infrastructure to deal with very strong population growth. And the Nelson Hospital has really been the focus of this. And Jess has got hold of some key data from Health NZ showing exactly how healthcare is rationed and the results of this sinking lid in squeezing down on not just the level of service, but also, of course, blowing out the wait lists for elective surgery and for consultations for elective surgery. I wanted to show you through these charts that Jessica has produced, and also some data that's come through from the Auditor General's office just on how much pressure there is on the so-called postcode lottery, which isn't just about postcodes, it's also about demographics. So let's go to a presentation I've just put together, which has these key charts. So the first last night of one of 3 reports that Jessica's going to do on the healthcare system. And it certainly is focused on these so-called CPAC scores. Now, the higher the bar means the longer and the harder it is to get an appointment for a specialist surgery. And you can see there that the Hawke's Bay, Nelson Marlborough and Waikato are amongst those with the hardest to get into waiting lists for general surgery. Also orthopaedic surgery, so this is hips and knees. You can see in this case Wairarapa, Taranaki, and the mid-central region are the worst. And interesting, Tairawhiti has the so-called lowest threshold to get in. And certainly that's an issue that has really started to flow through into the healthcare system, and that Jessica's done a great job. Also, we have a link in the report, in the email today, to an Auditor General's report showing that there are now, or there were at the end of December, more than 10,000 people who'd waited more than a year for a specialist appointment. And there were now 2,500 who had waited for more than a year on top of that. So the case cited in the report from Jessica of a 69-year-old with a very sore knee, who she says now has bone on bone grinding and still hasn't got a surgery, is a really good case of how when you put pressure on a system with a sinking lid, you push people into delay, you increase the amount of unnecessary pain, and of course you see services eventually cascading downwards, so failing at the fringes and cascading into the centre. This is all because governments of both flavours have looked to reduce the size of government to below 30% of GDP, which frankly isn't possible when you have an ageing population and increasing costs of healthcare, simply because there are new ways to solve problems and new drugs, new medical devices, that sort of thing. I'm Bernard Hickey. That was the Kaka for Monday the 28th of July. See you again tomorrow. Ka kite anō.